Hello everyone. So today we're going to be talking about circumcision. For newborns that are born male, circumcision is an option that is available. Circumcision is when you remove the foreskin from the head of the penis or the gland that is underneath. This procedure is done in a hospital setting, in a urologist's office, or commonly done by a mohel in a home birth setting. A mohel is someone that is a part of the Jewish community that will come into your home to perform this procedure for your little guy, if you have one. So circumcisions for the overall procedure is they will numb the newborn with a lidocaine or an injection or a numbing cream. And then they will take clamps into the head of the top of the foreskin where the opening is. And they will take clamps and clamp that and open it so that they can get something inside to separate the foreskin from the gland. That is adhered at birth and right up around until age 3. So they need to separate that in order to perform the circumcision. So they will clamp the skin, they will open it, they will go in with some type of Q-tip or a blunt scissor, and they will stretch that away from the head of the penis. They will make a bilateral incision down the foreskin, and then they will make an incision around to cut the rest of the foreskin off. This procedure does not take a long time, but it's not always pain-free for the infant that's having the procedure done. Some individuals will not perform the circumcision unless the newborn has their vitamin K shot. Vitamin K is to help babies and their blood clot. Babies have very low vitamin K at birth up until day 8 when their digestive system is kind of fully established and they're able to start absorbing it, and their increase in vitamin K happens around that time. So some mohels will do it without vitamin K. An interesting fact about mohels is they actually usually don't perform the circumcision until at least day 8 to 14. So day 8 is typically when vitamin K starts to rise in the little ones. So mohels don't typically recommend it or mandate it, but in a hospital setting and a urologist office, they do. Some benefits to having a circumcision done is there are some studies out there that state those that have circumcisions have less risk of getting UTI versus those that aren't circumcised have higher rates of UTI. So there's some studies out there for this. Risk of getting a circumcision done can be risk of infection, can be having to do it again because not all the foreskin was removed. And then also having it heal unevenly. This can be a problem later on in life when they get an erection, that it's now crooked because the skin is pulling to one side and not on the other. So these are all risks and benefits of getting the procedure done. It's a personal choice. It's also a religious choice and a cultural ritual that's done in many places around the world. So although not everyone chooses to do it, sometimes it's very important to certain cultures to perform this. So I hope this answers all your questions about circumcision, and that this video is informational and helpful to you.